All right, I was not going to do a video today because I was feeling really tired this morning. It was a lot like yesterday's video, so if you missed that, you can go watch that. That was dated 1/15/25. Today's 1/16, Thursday 25. So also I'm kind of going off the top of my head, so we'll see how that goes instead of a script, which is why I'm not wearing my glasses because I only need them for reading. So here we go. So this morning wasn't really feeling very good, and one of the things that I've talked about before is about 2 years prior, I did a lot of research on like death and dying and the difference between palliative care and hospice, and I learned kind of like the stages. Like the first stage is your digestion goes, and another thing that could happen is your cognitive abilities could start to decline. And I remember even telling my family and friends and colleagues, if you start noticing my cognitive abilities decline, please tell me. Now, one of the things that I can tell you, again, I have mild spina bifida. One of my vertebrae is missing, two grew together, and that really affected my stomach area. And every once in a while, even before the cancer, nutrients wouldn't absorb correctly into my stomach, and that would really give me a lot of brain fog, and I would tell people my chemicals are off today. So I can actually sense when my brain isn't functioning very well, and that was kind of a newer symptom for me this morning. Most of the time when I get up in the morning, I'll sit down, I'll type out my thoughts, or I'll reflect, or I'll write, and I just couldn't do that this morning. I just laid down there for a while and just slept because my brain chemicals were so off. Now, there are many reasons why my brain chemicals could be off, and it might be a combination of several things. One of them is nutrients not absorbing correctly, which can kind of happen when you're on hospice and you're taking different medications. But I didn't feel like that was the exact thing that was causing it. The drugs could also affect your brain chemicals. Taking it too much, not taking it enough. That could maybe be a little bit of the reason why. So I did end up taking a small dose of my medicine. I've been kind of experimenting with it. 10 milliliters seems to be too much, kind of hurts my pancreas and my kidneys. I've been experimenting with 5 milliliters and extending the time out a little bit, and that seems to work a little bit better. Anyway, another symptom that I learned just by chance, because I still research and I still watch Hospice Nurse Julie. I'll put her link below again, and I know I talk about her a lot, but she's like the #1 reason why I feel so prepared for this journey. Another symptom that I didn't know is gas. I did not know that having a lot of gas within your body can also throw off your cognitive abilities. So I mentioned that, and again, it might be a little bit TMI or whatever, but I throw this out there for anyone else who is on hospice, knows someone who's on hospice, has older parents, or maybe you just have a lot of gas and you're wondering why your mind's a little mixed up today. So I always say that I do think that I'm doing so well while on hospice. A main reason is because I do my medical things, and you can go back to previous videos as to what that is. It does have to deal with going to the restroom, and also my body, again, maybe TMI, it has a very difficult time passing gas. So sometimes my body acts like a balloon throughout the day, and it can be very uncomfortable. Well, once I actually did my medical things this morning, went to the restroom, very soon my cognitive abilities and my energy started to return. So there you have it. There's another symptom. If you know someone on hospice. Now, There are many, many reasons why somebody's cognitive abilities might start to decline. Some of it could be just the body is shutting down. I know someone else who has cancer right now, and I guess calcium was leaking into their body. Too much calcium caused their cognitive abilities to decline. Also, what was the other? Gas. What was the other one? I don't remember. See, I'm going off script, so there we go. The other thing also that maybe I want to talk about as well is the hospice nurse is like, you are so well prepared. Like, she didn't even ask me to create a care plan, and I have like a 12 to 16 page. It depends who's getting the care plan, because I actually have 2 care plans. I have one for my family, and I have one that I would give to like non-family members, because the one for the family has like passwords and stuff on it. So obviously for the one not for family, I delete all those passwords and everything. She's like, you are so organized. And I thought about it. For those of you who don't know, I've been a special ed teacher up until November this year, since 1997. And teachers have to write sub-plans if they're gone out of their classroom. And I thought, well, creating a care plan is just like writing a sub-plan. What would I do? You know, how could somebody take care of me if I wasn't able to take care of myself? This might be something that you consider for yourself if you are on hospice. If you're not on hospice, you know, if you're just getting older, I mean, eventually things could happen where at any age, someone might have to be making decisions for you. And so consider it a little practice. You could get yourself like a little journal or something like that, and just think about it. What would someone need to know if they were going to take care of you from the time you wake up to the time you go to bed? It doesn't have to be 12 to 16 pages, by the way. I also put in my care plan that there's probably 2 or 3 major pages that if they were going to look at, please look at those. So 1 page is just the generals, the top 10 things I want people to know about my care. And then I also created a daily schedule. Like, if I, for some reason, went paralyzed or unconscious or something like that, what would someone need to know in order to take care of me from morning till night? Or if my cognitive abilities decline, then people know what I want and what I need. So that was just a little topic that popped up this morning. Some of it's a little funny, some of it's practical. I hope that you are going to have a fantastic Friday, moving into a super Saturday and a soul-filled Sunday. And we'll see you when I see you next.